Like 40 miles of bad road, it's the Medicare for the Lazy Man podcast. The grass is greener under this Medicare podcast. And now still trying to catch flies with vinegar, it's Medicare expert Doug Jones.
Well, hello again, everybody. Welcome to another exciting and thrill-packed episode of Medicare for the Lazy Man podcast. As my Canadian nephew, Drew McMillan, may have told you, this is your Medicare expert, Doug Jones, talking, and I am ready to help get you through the Medicare morass unscathed. And I want you to come out the other side smelling like a rose. Now, how do I make this happen? Well, I encourage you to purchase my book, Medicare for the Lazy Man 2024. You can go to barnesandnoble.com or you can go to amazon.com. If you go to Amazon, you're going to find 4 versions. You're going to find the Audible book that you can listen to. You're going to find the very inexpensively priced Kindle book that you can download to your Kindle reader immediately, almost instantaneously. You're going to find the paperback, which is the workhorse of the whole collection. And of course, if you're inclined to be purchasing gifts for friends and family, you might want to spend $24 on the hardcover version of Medicare for the Lazy Man 2024 in the Amazon store, or the on-site store anyway. So that would be the king of the hill as it comes to Medicare for the Lazy Man purchases. I always suggest that people sit down with a stiff drink and start reading, and eventually the guffaws will ensue. And after that stiff drink has been consumed, one will realize that they have become a Medicare expert beyond the reach of even their closest friends and relatives. This book will lend such Medicare expertise to you or anyone who even basically puts it against their head and thinks carefully about it, that they will not need a whole lot of Medicare guidance from me. What they really will need from me is the insurance license that I have in each state of the union. So if you're in, let's say, Rhode Island, for instance, or Montana, or one of the Dakotas, pick your favorite Dakota, then I can help you get all of the Medicare coverages that you need to supplement actual Medicare. And I operate as a licensed legal insurance agent would in your state. So buy the book, read the book, contact me for assistance in wrapping up all of your Medicare insurance plans, and you will be one happy camper for as long as one can imagine time will exist. And in fact, speaking of imagining things, I keep imagining that Randy Carson is sitting in the middle of the Arizona Monument Valley. He's it's such a picturesque background that he's got me believing that that's where he's moved his offices to. Randy, tell me that you're really just south of Cave Creek, down the hill from me in Arizona.
I am just south of Cave Creek. The Monument Valley picture is one of my favorites. I mean, you got to admit you cannot beat Monument Valley.
No, it's absolutely magnificent.
But unfortunately, I'm sitting here just south of Cave Creek, closing in on 103 degrees, a nice spring day.
103 is not as bad as it could have been.
No. But I do hear that I have a job this morning.
Yes, sir, you do. As with every episode lately, we've got important information to share with the audience, and you are the primary person that's the conduit for that information. And
so I'm going to go ahead and pick out my choice for today's Medicare Disadvantage Minute.
Oh, you changed the name of it. Jeez. you scamp, you.
I know. So I'm going to go with number 5. As Medicare Advantage plans surge in popularity, More authorization demands.
That's what it says. And ironically, it was sent to us by the same Robert as valued client as sent us the last one. You picked a different article last time, and the same person supplied us with each of these two articles. So kudos to you, sir, for having recognized the value of our contribution here.
Anytime I can find a way to, show the true colors of Medicare Disadvantage plans, I will do that.
That's why I think it's important to do this repetitively, but not in a burdensome way. A little bit at the beginning of every episode seems like the right amount of unpleasantness, and then we'll get it out of the way and we can go on to other things. So, as Randy said, Medicare Advantage plans surge in popularity, but critics say authorization demands are also rising. This is roughly a year old, so it can't have gotten any better since then. Most medical groups say that the prior authorization requirements in Medicare Advantage programs are becoming more onerous, even as more seniors are signing up for the plans. In fact, 84% of medical groups say that prior authorizations demands in Medicare Advantage plans have increased over the past 12 months, according to a new report by Medical Group Management Association. Only 1% of the medical groups surveyed said prior authorization demands decreased in the past year. And the survey included more than 600 medical groups. With half of all Medicare beneficiaries enrolled in private Medicare Advantage plans, prior authorization reform has taken on new urgency at the federal level. Medical groups now identify prior authorization in the Medicare Advantage program as more burdensome than commercial insurance and more burdensome than Medicaid. More needs to be done to protect enrollees in Medicare Advantage plans. Most medical groups, hospitals, physicians seethe over the process of prior authorization, which involved getting the payer or the insurance company sign off on medications, treatments, and procedures. Insurance groups argue that prior authorization plays a vital role in controlling costs and avoiding unnecessary medical treatments and procedures. However, the American Medical Association and a host of other healthcare advocates argue that prior authorization interferes with patient care, delaying some treatments and at times leading to negative outcomes. In some cases, patients abandon treatment plans after enduring delays and in getting authorization. After enduring delays in getting authorization. 97% of the respondents of the study that we referred to earlier said that prior authorization process is delaying medically necessary care. So if you're a person who has signed up for a Medicare Advantage plan, and if you decide that you need some medical treatment, it seems to me that, as Randy and I have talked about in the past, the decision maker is going to not be your doctor or your hospital staff as to the treatment you get, but that decision maker is going to be an employee of the insurance company that you've purchased your Medicare Advantage from. And that may not be the way that most people want to have their medical course of treatment decided. So going on from the article, medical groups and physicians say they routinely have to make the case for treatment to health plan clinicians that practice in other areas. Nearly 3/4, 72% of the respondents say that when they must participate in peer-to-peer conversations in authorization requests, the clinician is not involved in a specialty relevant to the treatment. That's pretty interesting. Many of them say that the time-consuming process of prior authorization plays a leading role in physician burnout. In the survey that we alluded to, more than 1/3, this is 35% of the respondents, say that they spend more than 35 minutes on an average authorization request, times how many patients do they have every day. Critics have derided the authorization requirements of Medicare Advantage programs, which have gained increasing popularity. More than 30 million Americans are now enrolled in Medicare Advantage plans. The Centers for Medicare and Medicaid services reported in January. That's the government. More than half of all eligible Medicare beneficiaries have enrolled in these plans, according to the Kaiser Family Foundation. Insurers cite the growth of these programs as a testament to their value, saying they offer more coverage for seniors at little cost. I'll tell you what this is Doug talking now. They offer more freedom for companies that have made promises to their retiring employees to provide health insurance coverage forever. So what the company does now, instead of going to an insurance company as they used to do and as they used to have to plan to do, they would go to insurance companies and purchase the coverage, health insurance coverage for the retirees. Now what they do is they go to the federal government and they say, we want money from the Treasury so that we don't have to pay anything to cover our retirees' health insurance costs. That's why these plans are covering more and more and more people. It's not because those retirees want to be in a Medicare Advantage plan. It's that their employer, their former employer, wants to not have to spend any money, and they'd rather offload that huge financial obligation to the federal Treasury and make the rest of us pay for it instead. That's why these plans are so darn popular right now. The government proposed a new rule in December of 2023 that would revamp prior authorization in Medicare. Oh, excuse me, that was in 2022. It would revamp prior authorization in the Medicare Advantage plans, and providers have said that the proposal would make some much needed improvements. The rule would require some insurers to respond to prior authorization requests more quickly and to make requests more transparent. Some payers, insurance companies, would have to move to electronic authorizations in upcoming years. The American Medical Association said more than 100 medical societies wrote a joint letter to the government urging the agency to finalize reforms for Medicare Advantage plans. Lawmakers have been applying more scrutiny to the prior authorization demands of Medicare Advantage plans. The House of Representatives approved legislation to streamline the authorization process this year, but the Senate could not pass the bill before the congressional session ended. Many of those provisions are now in the administration's reform plans. Still, healthcare advocates have said that they'd like to see Congress enact measures to reform the prior authorization process, and they have noted that Democrats and Republicans have called for change. Well, we'll see, but it's kind of like putting a Band-Aid on a lipstick on a pig. Ooh, Randy's telling me an important fact here. I'm gonna listen carefully as our sponsors speak up and tell us what their opinions are, and then I'll be back. So listen for this break. Oh boy, I enjoyed those messages from our sponsors. I hope you did too, because they're paying a pretty penny. And when I say penny, I mean not much more than a penny to sponsor this program. We're pretty cheap. We come cheap. Okay, I've got a letter here that was sent to me from Blue Cross Blue Shield of Illinois. And typically, they don't send letters just to me. They send letters to all of their many, many, many agents, because in Illinois, Blue Cross Blue Shield of Illinois is a big deal. So here is the letter that they sent. It's kind of pithy and to the point. The subject of the letter is misleading practices, serious consequences. I guess one leads to the other. If there's a misleading practice, then there will be a serious consequence. And this letter says, we want to ensure that our members are enrolled in the plans that they intended with the agent or broker that they selected and trust. Protecting our members and our agents from any fraudulent activity is a top priority. We have been made aware that unauthorized enrollments and plan switching have increased in recent months and is creating a major issue, I say problem, for some consumers. This may be due to misleading practices or automated systems that allow switches due to technical problems. In either case, we are connecting with our members and our contracted producers to identify and address these particular instances. To avoid any type of misleading practice, we urge you to do the following: stay informed about regulatory changes, comply with consumer consent requirements, enhance client service, and stay on top of professional development. If we receive a complaint about an agent or a broker, or notice an enrollment irregularity, we will reach out directly to that individual and to start the escalation process that's listed below. So they have a sales escalation inquiry process and agent broker expectations for Blue Cross Blue Shield of Illinois. And I'm not going to bore you with that, but it goes on to say deceptive practices erode trust and have serious consequences for all parties involved. When brokers mislead members, it undermines the trust we have worked so hard to build as an industry. All contracted producers are expected to comply with the applicable law and the terms and conditions of their contract and the highest ethical standards. Failure to meet the requirements and or maintain records may result in additional training or disciplinary action or termination. Well, I just want to say that if you purchase a Medicare supplement plan, even one from Blue Cross Blue Shield of Illinois, you're not going to have the risk of having a problem like this. You're not going to be accidentally or inadvertently or even on purpose enrolled in a plan that you did not want. But this does happen with all too great frequency with Medicare supplement or Medicare Advantage plans. And it is a problem they're trying to address. One of the biggest miscreants in this whole process are the companies that advertise with such regularity during the fall and winter months during Medicare open enrollment. And what you're going to find is that those people are not insurance advisors. They're not the kind of people who will walk you through the whole process, help you pick out the best plan for you. They are the kind of people who have been taught how to strong the people on the phone, and some of them, not all of them, but some of them have been known to step over the line and without the person's knowledge, transfer them into a new plan. When they do that, they get double the commission and they get credit for a new sale, so they're eligible for all kinds of bonuses and stuff. They don't do this stuff for their health. They don't do it just to have fun with you on the phone. They actually steal money from the rest of us by virtue of their poor sales practices. So that's what Blue Cross Blue Shield of Illinois was warning about. Another scam, besides the ones perpetrated by Medicare Advantage zombies, is called brushing scams. This was new to me, but it's a brand new item that was published on July 8th of this year, 2024. Brushing scams. A new warning. Scams are dishonest schemes. Well, I think we knew that. They're performed by bad actors. They often prey upon unsuspecting victims to steal identities or money. The United States Postal Inspection Service has issued an alert to people about brushing scams. What are they? They are e-commerce scams that involve people receiving packages or parcels in the mail containing items that they did not order. Frequently, there is no return address or retailer information. The items are usually sent by an international third-party seller seeking to achieve verified merchant status. The sellers seek to write personal product reviews. The sellers seek to write personal product reviews on someone else's behalf and without their permission to inflate product ratings. Per the US Postal Service, since the merchandise is usually cheap and low cost to ship, the scammers perceive this as a profitable payoff. While getting free stuff sounds appealing, it is not so good after all. Why is getting free stuff bad? Well, the Postal Service explains that while it seems like a victimless crime, the reality is that personal information is compromised. Most of these sellers get the addresses through nefarious means and with ill intentions. It means your personal information is out there for other scammers to use. Additionally, fake reviews may cause individuals and businesses to purchase items that are not worth the money. Experts caution that sometimes addresses and account information are also used by bad actors to deliver and steal merchandise without a victim's knowledge. I don't get it. I'm still not seeing why this would be a problem for somebody who's a victim of the brushing scams. So the next paragraph says, geez, I'm a victim. It's quoting somebody saying, geez, I'm a victim. What should I do? If you think you're a victim, take these 5 steps. First, do your best to guard your personal information. For example, only perform safe and secure internet transactions. Keep your personal information, like your bank account and social security numbers, private. Okay, I think we all knew that, so I'm not seeing um, any unusual problem with that. Step number 2, if you get a strange package and it's unopened with a return address, the United States Postal Service will return it on your behalf at no charge. Also, if a bill is included, never pay for merchandise you did not order. Third, if there is no return address and you opened the package, decide whether to keep or donate the items. The Postal Service says that by law, you may keep unsolicited merchandise and you are under zero obligation to pay for it. Fourth, closely monitor all of your accounts as well as your credit reports and credit card bills. Since there is a possibility that your personal information is compromised, change your passwords as a precaution. If the merchandise you receive is possibly dangerous, notify the authorities. All right, well, that kind of fits in with number 1. You're going to do that no matter what. The brushing scam should not affect that behavior. So number 5, if the unsolicited merchandise is sent through a recognizable third-party seller such as Amazon or Temu, T-E-M-U, that's a new one on me, contact the company directly via the official company website to make sure the shipper doesn't simply have the wrong address. Note that brushing scams are prohibited by most online shopping companies. If a brushing scam is detected, file a fraud report with the third-party seller and have them remove any fake reviews appearing under your name. All right, well, doesn't seem like such a tragedy to me, but that is, I guess, maybe I don't know everything. It's all possibly a more dangerous scam than I would have thought. So I gave some thought also. It's rare that I think. I listen to a podcast regularly. They've got one little episode every day, and it's the length of the episode is somewhere between 5 and 15 minutes most of the time. It's called Wiki Listen, and what they do is they pick a subject in Wikipedia every day to read the page on, and sometimes it's an interesting subject, and sometimes it's something that these people are interested in. My personal view of the idea is that it's kind of an interesting idea. My personal view of the people that are the hosts of the Wiki Listen podcast, one of them is, I think, brain damaged, maybe dropped on her head several times when she was a child. Just is impossible to come up with rational thought. She's a communist. She's got other problems, and she's pretty funny. So every time she says something, there's a lot of yucking it up. The other host is something somewhat less problematic. But because I find this personality defect interesting, I listen to every episode of Wiki Listen. And then I thought to myself, well, since I listened to this thing, I wonder what they would do with the Wikipedia page for Medicare. Now, would they actually consider even approaching the Wikipedia page for Medicare? Because it's about, if you printed it out like I just did, it's about 100 pages long. And then I thought to myself, wow, we have a Medicare Advantage Minute in every podcast episode. Perhaps we should do a Medicare Wikipedia page minute or two and see whether we get into, after a few episodes, we get into the meat of this subject. So if I were to start with the beginning of this, I'm not going to get very far because, like I said, it's about 100 pages long. But if you were to go to Medicare Wikipedia, then it's going to say Medicare United States, not to be confused with Medicaid, which, as we all know, is more of a welfare type of health insurance benefit. So Medicare, the website is medicare.gov. It was formed July 30th of 1965, 58 years ago. The headquarters are in Baltimore, Maryland. The agency is, the agency executive is Chiquita Brooks-LaSure, and she's the administrator for Medicare. Parent is Centers for Medicare and Medicaid Services, and the website is www.medicare.gov. The Centers for Medicare and Medicaid Services is the logo that then appears on the Wikipedia page for Medicare. And then it dives into the actual meat of the whole thing. Medicare is a federal health insurance program in the United States for people aged 65 or older and younger people with disabilities, including those with end-stage renal disease and ALS, Lou Gehrig's disease. It was begun in 1965 under the Social Security Administration, and it is now administered by the Centers for Medicare and Medicaid Services. In 2022, Medicare provided health insurance for about 65 million individuals, more than 57 million people aged 65 and older, and about 8 million younger people. According to annual Medicare trustees reports and research by Congress's MedPAC group, Medicare covers about half of healthcare expenses of those enrolled. Enrollees almost always cover most of the remaining costs by taking additional private insurance and or by joining a public Medicare Part C and or Medicare Part D, as in Delta, health plan. In 2022, spending by the Medicare trustees topped $900 billion per the trustees report, Table 2B1, of which $423 billion came from the U.S. Treasury, and the rest primarily from the Part A trust fund, which is funded by payroll taxes and premiums that are paid by beneficiaries. That's you and me, ladies and gentlemen. Households that retired in 2013 paid only 13 to 41% of the benefit dollars they are expected to receive. No matter which of those supplemental options the beneficiaries chose, private insurance or public health plans, to make up for the shortfall of what Medicare covers, or if they chose to do nothing, beneficiaries also have other healthcare related costs. These additional costs can include, but are not limited to, Medicare Part A, B, as in Bravo, D, as in Delta, deductibles, and Part B, as in Bravo, and C, as in Charlie, co-pays. The costs of custodial care, which Medicare does not consider health care, the cost of annual physical exams for those not on Part C, as in Charlie, health plans, almost all of which include physicals, and the costs related to basic Medicare's lifetime per incident limits. Medicare is divided into 4 parts: A, Alpha, B, Bravo, C, Charlie, and D, Delta. Part A, as in Alpha, covers hospital, skilled nursing, and hospice services. Part B, as in Bravo, covers outpatient services. Part D, as in Delta, covers self-administered prescription drugs. And additionally, Part C, as in Charlie, is an alternative that allows patients to choose their own plans with different benefit structures that provide the same services as Parts A and B, almost always with additional benefits. The specific details on these 4 parts are, and I think that's where I'm going to call a halt to it for today, but the Part C, as in Charlie, plans you may have recognized as being Medicare Advantage plans, the plans that we strictly regard as lack of freedom and probably a poor idea for most people that are involved in Medicare. At least that's my plan. My intent is to always warn people away from Medicare Advantage plans unless they have absolutely no other choice at all. Randy, I hope I didn't bore you with the reading of the Wikipedia page, but we could fill up about maybe the next year and a half's worth of podcast episodes if I continued on with that stuff.
Well, no, it certainly wasn't boring. Every every episode is a great piece of information. I just wanted to point out, though, that bottom line is we don't call Medicare Advantage plans crap vantage for nothing. Okay.
No, we sure don't.
Bottom line is don't let anybody fool you. They haven't changed. It's still crap vantage, and stay away from them with if you have a 10-foot pole, I would use that to stay away from those particular plans. Now, I'm going to have to hurry out of here because, our time's up. The 75-cent clock just rang. I've got a bunch of boxes on my porch that got delivered this morning that I didn't order. So I got to go check them out to see what they were.
Listen, I'd say open them up, and if you like the stuff, keep it. If you don't like it, either throw it away or give it to bums on the street or whatever.
Absolutely. So
After
anyway,
reading that whole brushing scam thing, I really don't see the problem.
well, there's not a huge problem, but eventually, if that kind of thing starts happening to you, somebody's got your number.
Yeah.
And they're going to get you somehow. But anyway, that's a whole nother story for a whole nother time. But long story short is grab your pencil, people. You need to write down this email address, dbj@mlmmailbag.com. Doug waits anxiously every morning out in Illinois, in the low ground out in Illinois, to see if he's got any mail. He stands out by his inbox. I've seen him do it. He's just out there, just one foot then the other, waiting to see if he got anything. So don't let him down. dbj@mlmmailbag.com. Don't forget, Doug is licensed nationwide to help you with your Medicare supplement planning. Check us out at the website, medicareforthelazyman.com. We would appreciate it in your wanderings or walkings or drivings or flyings through the internet to drop a review on the content. Doug works really hard on it, and it is probably the most valuable piece of information on Medicare, probably available for free. So anyway, long story short, last but not least, thank you for joining us. You could have been a number of different places, and you weren't. You were with us right where we want you with Medicare for the Lazy Man podcast. And as always, if you weren't checking your watch, you have just spent about 32 and a half minutes with Doug Jones, the anti-insurance insurance guy, originally from Oklahoma. He's an Oklahoma boy through and through. And bottom line is he's out in the low ground of Illinois. I don't know why. He's fighting off Pugsleyville. He tells me that it's hard getting out of Pugsleyville sometimes, but he fights his way out of there. So I'm going to turn it back over to Doug to give you the last word for today on how to stay out of Pugsleyville.
Well, one way to stay out is to chase Pugsley away. And that seems to be happening because Pugsley really wants to be the presidential candidate. And so we're hoping that he throws his hat in the ring. And when the Democrat convention happens, that Pugsley is one of the stellar targets of their nomination process. But we'll see if that happens. The good news there is that Pugsley would be gone from Illinois. The horrible news for the United States would be that Pugsley would be contending to become the next president. I don't think either of us or any of us are looking forward to that. So anyway, thank you, ladies and gentlemen, for joining us today, and we will look forward to talking to you during our next episode. Bye-bye.